Hi, this is Colleen with Chats with Colleen, and we're so glad that you're here joining us for our bi-weekly podcast edition. This week's episode features Anna Grano. She is a nurse practitioner, and we are going to dive into issues with her about mental health issues and substance abuse and how they can commingle and coincide, and how people sometimes reach out who are struggling to take drugs or alcohol or misuse medication. So it's a really hot topic these days about mental health, substance abuse. So I wanted to combine it and give just a general details and information on it. Remember, this is for informational purposes only. If you or anybody that you know is suffering with substance abuse or mental health issues, please reach out for help. There are tons of resources to help you and your loved ones and your family and your friends. If this episode can help somebody else, please like and share. Also, reach out to Anna on her social medias, which we will tag below. Thank you so much and enjoy the show. Hi, this is Colleen with Chats with Colleen, and we're so glad that you're joining us today for our podcast edition. Today I have Anna Grano, and this is her second time with me. This time is in person, so thank you for joining me.
Yeah, thank you for having me.
So we're going to talk about her career as a nurse in the psychiatric realm, if I can pronounce it. Is that correct?
Yes. Yes.
Okay. So from your perspective as a psychiatric nurse practitioner, how do you see people that experience trauma coping with possibly substances such as maybe drugs or alcohol or their prescription medication?
Okay, so hold on real quick. Can I step back just a second? Because I don't want anybody to be like, she's not a psychiatric nurse.
Sure.
I'm a nurse practitioner, but I work in psychiatric.
Okay.
Like I work, right? So there is a specific degree for psychiatric nursing.
Oh.
I have a family. I've got my degree in family, so I could do kind of whatever I wanted to do when I came out. And I just happened to work in psych. So I don't want to offend any other psychiatric nurses.
So there's a whole degree that they get.
There's a degree.
Oh,
yes.
wow.
But what happens is, I mean, you have to have like a full blown love for it, because if you do get the psychiatric nursing, you then can't go into, like, let's say pediatric or,
because they probably work more in the psychiatric, like ward type, not just deal.
Right. Anywhere in that field, but it's narrowed down to that's what
they could never
is. That's
go
their
elsewhere.
specialty. Right. I think they probably could, but it would be hard.
Oh, wow.
So just to clear that up, sorry. I just don't want anybody to be like, lies.
No, thank you.
So start with the question.
Okay, so the question is, when people experience, mental health issues, sometimes it's from past trauma, sometimes it's just hereditary or life going on. I see this a lot with my clients, even though we're not in health-related field. I see them probably turning to like substances or misusing their medications. Is that something common?
Yes.
Yeah.
It depends. It depends on what the medication is. So if it's like a controlled substance, which is why they became controlled substances, it's like if it's a benzodiazepine, I always tell everybody, when I write those medications, which is, I do write them, but they work extremely well, and there's not a real close comparison, right? So those medications work really fast, and so they, especially for anxiety, so they, when people have anxiety that leads to panic attacks, you take, a benzodiazepine, it helps you, and it brings down that sensation almost, and it can get to the point where the sensation's gone completely without somebody doing other coping mechanisms. They work really, really well. The problem is they're very addictive. So there's weaning that has to happen. There's withdrawal that happens with them. And because there's no close comparison to something that works that quickly, I think that's why they end up being kind of more preferred. Once people feel how fast it helps them,
they like it, and then
they like it. They trust it.
That one doesn't work, or half of one that they were doing, then they need more and more,
right,
to experience that same feeling. It's kind of like an escape. Like, when you get that first drink, like you like the feeling, and then you want another one because you're like chasing it.
Yeah.
So that's why. And I see that,
there's a particular person that I know that takes Xanax. He may get it from another person, you know, a prescription. And it's like, I always wonder when I speak to him about it, is it like really working for you? If you're taking like the lowest dose of one Xanax pill a day, I feel like you're now like dependent on that because you feel if you don't take it, like you're not going to feel like the same.
Yes.
So I feel like that, like you
There's
said,
a lot of that.
it's a rescue medication. So, and then of course, if you're taking something every day, any medication, if you stop taking it, you're going to be like, I don't like the way I feel. I feel something feels different because your body was used to having that every day.
Yes, that is true. At the lowest dose, it depends on how, so those medications, and I'm only using them as an example, those medications are not supposed to be taken on a regular basis. They're more like emergent or quick or, what's the word I'm looking for? Almost not the same thing, but almost like if you had an allergic reaction and you took an EpiPen. It's that kind of thing. But the problem is that they've been prescribed regularly. And when, like, you know, when people need it to function, let's say you have a job and it's high stress and you take a, you know, little medication and you're able to do your job and get done with your things, then you do. And you end up taking it on a regular basis, which you're right, the efficacy ends up not being great.
It's not really working. So if you really were having like that anxiety or panic attack, which you would use it for, you're
Probably not going to help.
It's not really going to help you.
You're right.
That's why. So when we often hear about, you know, medication helping people and then it's sometimes misused, what are the signs that somebody's like relying on that medication? Just a few, because I'm probably sure there's like thousands.
Yes. So I've been doing this for about 6 years now. I can tell almost right away when somebody, you know, if I'm meeting you for the first time and you're telling me that's the only thing that's ever going to help and it's the only thing that helps since the beginning of time, then I'm already like, it makes me wonder if anything else has ever been offered, you know? And again, coming from the side of a practitioner, you know that those medications are going to help your patient. And when you hear, you know, the whys of why people have gotten to the point of that, you know, needing it or whatever has happened in their life that has gotten them to the level of anxiety that they can't function without it, you understand those things. You also know that that medication is going to help them, but it may not always be the best thing. And it's a slippery slope because you're going to need more. You're going to take it on a regular basis. That's where the misuse comes in because you know that it, you know, unfortunately it does help. It is a good medication. So, but it ends up being a slippery slope in the sense that no other coping skills or other medications are offered or even, what's the word I'm looking for? Like trialed.
Yeah.
Because the patient already knows this.
They already know what they want.
Yes.
Yeah. Like
they already know what they want. That's exactly.
They already know what they want, so they already know to tell you. And
exactly.
It's fine being in touch with your body or your mind to tell like a doctor or, you know, a nurse practitioner, anybody that what you've been doing. But I feel like when you're trying to go and ask for like help and suggestions, and then they're not
they
willing.
all get vetoed. Right. Or like you give a suggestion, you're like, have you tried this? Have you done this? Because there are maintenance medications that you can take that will keep your anxiety low. So you don't need those extra added. But when all those get vetoed, then you kind of can understand where.
And then it becomes unhealthy. And then I wonder, and then what about when someone's like doing any medications, like even if it's just like an antidepressant or like some of these pain medications or whatever that they take. And then what if they start mixing like other stuff like alcohol?
Yeah, that's not a good idea. All those medications have, you know, those warnings that alcohol is not, you know, but you shouldn't take it.
Or even like medical marijuana, because I know if you go to get like medical marijuana, there's like specific, you know, scenarios as why it would be prescribed, but then they always are going to ask you what other medications are you taking. And then I wonder, do they have access to see what like your prescriptions are? Like, you know, how when you go to another doctor, they can always pull up what you take and they're like, oh, okay. I wonder if they're not honest to tell them what they're taking.
I don't know. I don't know what the stipulations are there. I would hope that you would have to show some proof. You would have to show, I don't know, because that's a different, medical marijuana, you have to have different, not credentials, but different, what's the word I'm looking for? maybe even licenses.
Certification, license. I don't know if you just have to be like
no, you have to have different certifications.
A doctor,
for
yeah,
it. Yes.
for that. But I don't know if you could be a nurse practitioner and do that. That's like the one question that I have.
I think you can, but you have to go through the training, right? So you'd have to go through all that certification so that you're well aware of what you're...
Yeah, because, you know, like I always wonder, like marijuana can cause, like in high doses, or any dose can cause like rebound anxiety. And so can like alcohol. So then they're like taking that, then they're going back taking Xanax, and then they're going to take their antidepressant, and they're not going to have like full effects.
Yeah.
And they're just like, oh, I got to do it again because like this brings me up, that brings me down.
Yeah.
And it's crazy. And the reason why I really wanted to speak to you is because I have an acquaintance that I know that I feel has some possible, you know, trauma issues that cause, you know, some mental health instability in her. And then I feel like she said she was on antidepressants and all this stuff, and she didn't want to take it because it's poison, but it almost seems like to me like she does some type of street drugs, you know, that kind of makes her paranoid at times. And so I always just wonder when, like, how would somebody not want to take those medications that like you would prescribe and want to go to like something else that's like illegal substances? Maybe they don't really like the way that they were feeling like normal, or like they're not used to that and they're used to being the other way, which is like chaos.
Yeah. Maybe it's hard for them to go to those appointments there's all sorts of reasons, right? So let's say she doesn't want to go to the official appointments and talk every single time, or, you know, I don't know. You don't know. Maybe somebody's given her a little resistance and she's like, well, why would I get that? Why would I go to this professional and get that resistance when I can just go over there and never get resistance? I don't know. I mean, it could be a billion different reasons.
A billion things.
Yeah.
And you mostly, I know you told me you work with like the elderly community. Do you work with all ages?
Not pediatric.
But it's like 18 and up?
18 and up.
18 and up, so you
my
work with
youngest
adults.
patient was maybe 22.
Wow.
But very rare.
Very rare.
Very rare.
So I always wonder with like the elderly, are they like open to like talking about like what symptoms they're feeling and how they feel and what like experiences?
Depends on who it is. It's person to person, but that is a tough generation, and especially male.
Oh, yeah.
Elderly.
I can't imagine.
They're more resistant to medication and talking.
Right.
So, but it's getting a little better, I think. It is. And I think that once you have an honest conversation with a patient and they're able to take a medication and recognize how different they feel, or they get feedback from family members saying, you know, mom or dad, you're doing so much better, or you're out socializing, or then they realize, I think they can let go of some things when they realize there's an improvement to their lifestyle.
Mm-hmm. Yeah, because I know that I take antidepressants, you know, Lexapro. I've been taking that for like over like 12 years, and I dealt with anxiety, which I still do. And it took me a long time to get like, take it and have it like work. And I was afraid. I tried like all these in my 20s, and I'm like, no, because my anxiety, it would make my anxiety like worse. And then finally, like in my 30s, I was like a little bit more relaxed, and I was like, and I had to go through like that time where like, couldn't sleep or you couldn't do anything, and then it started helping. And then I'm like, well, no, why would I not take this if it's helping me? And then somebody would be like, oh, you're crazy. Well, fine, I'd rather be crazy. And now I'm not as crazy, but I feel like it's such a common thing.
Yes,
especially like for women in your job, that like you just talk about it and you can be open and tell people, and they're like not going to judge you. And feel like, well, why should I be afraid of this? I mean, if I had diabetes, I would have to take insulin every day.
Absolutely. I think it's getting better. Do you feel like it's getting better?
I feel it's getting better because it's more open. It's more like advertised. People can do telehealth and they can get it and just learn more about it and realize that it's like something that's happening more with this, you know, like the crazy world and all like the overstimulation that we get with our phones and work and just so much drama and stuff, that it's just like to calm, you know, calm.
I agree.
Puts like a damper on it. So that's what I advocated for it. And for me, like, do you think like an antidepressant is like something that's addictive?
Not all antidepressants are addictive. You can come off of it. There's no weaning. Sometimes you can have symptoms. You obviously should not go cold turkey off of it.
Right.
But there's not the same symptoms as if you were on a controlled substance.
Right. Okay, good. Well, that's good to know. And what point do you think like coping turns to something that's like harmful or like addictive?
That's a loaded question.
Right.
So what I've noticed, I used to work a job previously where we added counseling into any medication management we had, especially if somebody was on a controlled substance. That was like a protocol. If they're on a controlled substance, 100% you have to talk to a counselor.
Okay.
They could get their outside counselor, or they could talk to somebody who was part of our organization, which I loved. And it's the same way I look at those diet apps that come out now, right? It's not just about changing your diet, it's about changing your whole lifestyle.
Yes.
So it's now kind of gearing towards that with psychiatric, with depression and anxiety. That's where I see people getting to the point where they use that one tool as their coping skill and they never develop any other coping mechanisms, including talking to somebody and just figuring out, how did I get to this point? Or what is it that's making me feel this way? Right? And then stopping. I mean, sometimes it can even be just a habit you have. You don't even realize, like we were just talking about, all the stuff we watch, the documentaries, the crime stuff, right? So when you watch a lot of that stuff, you're not even realizing how it's affecting you, because you're not sitting down after it and going, how did that documentary make me feel? You're not, you don't realize, after watching multiple things or listening to it all day long,
it's in your head,
how it's affecting you. Right. And then you're taking that to another situation, and maybe it's skewing stuff. You're not actively thinking, okay, I should stop doing that. I'm going to stop listening to the crime stuff and I'll listen to some funny stuff, or I'll listen to music, and realize how different you feel after that. Right. I just lost my whole train of thought. I guess what I'm saying is that people aren't taking the time to figure out other coping mechanisms. They're not figuring out what is triggering it, what's making this worse. Can I stop what I'm doing? I know myself, if I have a couple other stressors, I have children, I have jobs, right? And if I listen to too much of it, I take a break from it. And it does make a difference. Just in a matter of not that I feel like, after I listen to that, because I do enjoy listening to like the forensic side of things. But it does make a difference. I mean, there's times when I listen to music, for several days in a row, and I'll think to myself like, I do feel a little less stressed. Yeah.
Yeah. I do the same thing with like the talk radio. I listen to it, and then sometimes I'm like, it's just getting me like, I'm getting myself pumped, and my blood's already boiling. Yes. My blood pressure's probably high, and I haven't even started my work day. So I'm like, I'm just going to put on music or, anything. And I'll do that like on the way home too, because then I got to go home and it's like my second shift.
Something else happens.
Yeah. Deal with my husband and my son and finish up my work day. But it's just
recognize that.
But you recognize it, and I want to go work out. That's why I like to work out after work, because I'm like, I have all that pent up energy that I need to get out. So yeah, you're right. A lot of people don't do that, because you know why? They want everything fast. They want instant gratification. Like if it doesn't work like that moment, it's like, oh, forget it. I tried it. Well, how many times did you try it? Oh, I tried it twice and I didn't like it. I hated it. It didn't work. Yeah, that's what I see now. I'm like, well, you have to give it like a chance.
Yeah.
Like,
yeah. So I think part of what can happen is if you have other coping mechanisms. I talk with patients all the time. When you feel that way, what are you doing? Or what did you do before you felt that way? And a lot of times they'll say like, oh, I was talking to my sister and blah, 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 blah. And I'm like, oh, okay. Right. So you understand, once you place those two things together, then you can start to, after you talk with your sister, maybe you need a break. Maybe you take time to just relax. Maybe you cut that conversation a little shorter because it's maybe not healthy. Right. So it's things like that where I think if you were to develop other coping skills or recognizing where it comes from, then the abuse of some of the medications maybe won't be as bad, because you have other ways to treat your symptoms. It's not just that one thing.
That takes work that some people just don't want to do.
Yes. Yeah. That's true.
Yeah. So like you were talking about the coping skills, so it's just people have to be more aware of themselves and realize like it's okay to be mad, it's okay to be upset, it's okay to be depressed. But then when you start to become like so depressed that you're just like unmotivated to do anything.
Yes.
And I've noticed this with somebody like particularly in my life for like a year, life changed, big things happen, and he's just not the same. And I feel like trying to motivate him is difficult.
So hard.
And then that becomes back on me because I start sucking up that. Like, I feel guilty, I feel bad. So it's like a hard balance.
Can't change it.
You can't change it. You can't do anything.
You
and
can't
so
fix it.
it's like the way other people are, especially if they're like mad, angry, sad, and they're like either working with you, living with you, around you. It just, that feeds off into other people.
Yeah.
And I think people have to realize that too. Mm-hmm. And it's sad. And then that's where they like, oh, I'm going to go to work after work, have some drinks. And then it just becomes like, I'm happy at that time having drinks.
Yes.
Doing
I'm not
this.
thinking about all the
I'm
other
not thinking
things.
about that. And then when it wears off, they're like, oh,
There it is again.
there it is.
Yep.
That's when people have to recognize that they need some help.
Yeah.
Look at us. We could change
Fixing
the
the
world
world.
here. Have you ever had to deal with, I know that, working with the elderly is difficult. And I dealt with my mom, like, towards the end of her life with her dementia. And, like, she had such severe anxiety. Mm-hmm. And I feel like it was pent-up anxiety that she had her whole life. And I feel like that's where I got my anxiety. It's, like, hereditary or whatever. And then her mom had it. But when she was, like, the brain was, like, changing or whatever, the anxiety was, like, so rampant. Do you know, like, why that is? I've always wondered that.
I mean, I'm sure that's a tough question. I'm sure there's physiology to
Right.
it. Because there's deterioration, right? So your thought process is actually, it's not the same.
Diminished.
Right? Yes.
Yeah.
So you're, getting from point A to point B is not easy or as easy as it once was. So their rational thought is probably, and a lot of times I see patients recognizing that they're not remembering, and then that
It stresses, it makes it worse. And then, like, the medications at that point, like, don't really work.
So and there's not that many, but they have some medication that stop the progression of it, but you can't reverse it and you can't stop it completely. So it's just kind of one of those things where you have to, what I notice makes a difference in patients like that are caregivers that are educated in dealing with things like that, not taking it personally.
Right.
Not, if a patient says, there's so many very common, like, anxiety, feeling like people are stealing from you, the paranoia that comes along with it, not feeding into that. If you have a good caregiver that can kind of validate what you're saying and then kind of distract you onto something else, those are the best. There's some that are, everybody gets educated different. If you feed into it and you're like, let me help you find it. Let's look for this thing.
I would always play into it. Oh, really?
Well,
Tell me more about it.
It's because then it just, and sometimes it's not true. So
Right.
let's go off of the false accusation one, where if you're going to constantly say to Fred that this thing is missing and you're helping him find it and you're looking around and who did this to you, then you're just perpetuating.
You're confusing them even more.
And there's no resolution to it. You're not going to then, it's not, yes, some days are more clear than others, but it's not like you're going to get to the point where he's like, okay, good, I'm done. I'm moving on. I understand now. It doesn't work
that way. Mm-mm. And do you see anxiety with your patients? Are your patients more men or women?
Both.
Oh, both.
Mm-hmm.
Okay. That's equal. I was going to think it was more women because
No,
they would be more open and, like, acknowledging.
Yes. Yeah. It's probably if I counted it out, I probably have more female patients, but it's going to be pretty equal, I would imagine.
Yeah, and I think, like, a lot of times, people are afraid. Like, they know they need to do something, but then they're, like, afraid to go, like, say, oh, I know this is, like, something that somebody told me. I'm afraid they're going to, like, send me to a hospital. I'm like, I mean, if you're going to harm yourself.
If you need it,
then yes. Yeah. I mean, that's the scary thing. But just because you're depressed or you're dealing with something, that's one other thing. Someone told me, I'm not depressed, I'm not suicidal. I'm like, I'm pretty sure you don't have to be suicidal to be depressed. Mm-hmm. I mean, it's obviously extreme depression, mm-hmm. You're at that level. But, for the most part, you're just depressed. There's something going on that's got you slumped, stuck, and it doesn't mean you're suicidal.
Right.
I mean, that's scary to think about that because it's when you read the symptoms, it's one of them.
And that's almost like worst case scenario, right? Not almost, worst case scenario. If you're already there, you've been depressed, right? And if you look at the assessment questions, and I get this all the time from my patients, because I'll say, how's your appetite? And they'll be like, fine. And how are you sleeping at night? I sleep okay. Why are you asking me these questions? How come every time I see you, you ask if I'm sleeping and eating? Because when you go through anxiety, when you have symptoms of anxiety and symptoms of depression, that's how they show themselves. If I ask you straight out, and if you're a patient who's, taking a medication but doesn't feel like you're depressed, you're going to say no to everything, right? Do you feel like this? No. But if you ask questions like, what are you interested in during the day? And they can't give you an answer. I'm not interested in anything. That's a sign, right? Is there an activity that you like to, I always ask patients, what's your favorite activity? Because if you say, do you do things during the day? They're always like, yeah. And then I'll have to say like, well, okay, name something for me.
What did you do today?
What do you do today? What's on your agenda?
They're just very like apathy, like just not much.
Everything's good.
Nothing. Yeah, everything's good. They're not excited by anything.
Right. But if you ask the questions on like a PHQ-9, you'll see that it's more about everyday things. And it's all those little things. If you're not eating, that's a sign of depression. If you don't feel good enough to, even have an appetite, if you have a loss of appetite, that's a sign of depression.
And then overeating too.
Overeating too. And if you have multiple things that are showing me that you might be dealing with depression, you just aren't acknowledging it, or you just don't think that's what depression is, like you were saying.
Yeah, you don't think that's what it is. I'm not this. I'm not like, sleeping all day.
Yeah, I'm going to work. You know what I mean? I'm in a relationship. I'm fine. So I don't know. I think it can be sneaky.
I think it can be sneaky, for
Anxiety
sure.
is a little more prominent. You can tell, right?
Yes, especially as a woman.
Yeah.
Especially certain times of the month, your anxiety is like on up the mountain.
Yeah. Okay. And I think anxiety presents with actual physical symptoms.
You get physical muscle tension, neck tension, which I have now. I've been dealing with it a couple of days. But yeah, muscle tension. I'll get it in my legs. Yeah. My legs will get extremely tight. They'll get wobbly. I mean, you get heart palpitations, sweats, cold chill. I mean, you get a whole thing. Headaches, insomnia. I mean, you get a bunch of things all at one time, Feelings of doom. Oh, my God. Like, it's just... Yeah. So if anybody ever wants to ask me what the symptoms are, I can give you a whole list of them, unfortunately. But, it is what it is. Yeah. Some of us get it. And like, I always used to say anxiety was also like excitement. Because as a kid, I was like, talking. And they're like, oh, my God. I was like, I'm just excited. And then I'm like, well, what? There's nothing wrong with me. Yeah. I just like talked a lot and I was like hyper. Yeah.
Here's another thing that I always try to stress is that anxiety doesn't always have to be bad. It can be a great motivator. If I feel anxious about a bill, I'm like, I'm not going to wait until 5:00 tonight to pay that bill. I'm just going to go on my phone right now and I'm going to pay it. So it's like, it doesn't always have to yield bad things. It can yield success. I mean, because the energy that you have, look what you've accomplished. So it's like, it doesn't always have to be a negative
thing. It's good. Like, I always say, like, you feel the same way if you're excited or anxious. Like, it's going to produce the same, like, feelings within your body. So just, it's more or less how you, like, approach it and use it. Yeah. And, like, don't let that little thing keep touching you. I'm here. Hi, you remember me? Yeah. I'm like,
I've said to my husband that exact thing. It's like the same anxiety that I have towards this is the same emotion I'm putting towards this. So it's like, it's the same person. It's just,
Yeah,
does
you're
that
the
make
same
sense?
person. Yes.
Like that emotion that you have can also be in a good way. Sometimes it's not, but sometimes it can be.
It can be. And you're right. You're very right. So, you are right because you're the professional and I'm not.
Well, that doesn't make me right.
So another thing I heard, I've been hearing some crazy stuff this week. So this week I heard, amongst other things, this week I heard like a good friend telling me that somebody close to her has been self-harming. And he apparently cut himself, I don't know, once or twice, and he didn't like it, so he's not going to do it again. Okay.
I'm not super familiar with that.
I'm not familiar with it either, but I know, and this is a person who is under psychiatric care on medication. So I felt like she did reach out, to the doctor, and they're making some changes. So I also feel like that is something extreme. If one of your patients ever came to you saying that would be like, I'm not comfortable with this, I got to get you someplace else.
Yeah, more than likely.
Yeah.
And I'm also, acute care. Like I don't work in an emergency room. We don't do emergency cases and things like that. So, with
yours is just long-term patients that come back. And how often do you see your patients?
Care once a month.
Once a month?
Yeah. And my patients are typically in assisted living facilities.
Okay.
So they have eyes and ears and help all day long. So
this is just extending their care.
Yes.
You go in there.
Or continuing their care.
Exactly.
Yeah. Making sure that
in their care team. I think that's what they call it, right? In the care team.
Making sure that they're on the appropriate medications, that their medications are making a difference, if changes need to happen, that kind of thing. But I don't have patients where I see them and then they go home.
Okay.
My patients are always
in a controlled environment. Okay, good. That makes it better.
Yeah. Yes.
Because, I'm sure you get calls and stuff at times, but...
yes. And even in emergent situations, I'm not the person that shows up. I'm not the one that they call for emergent situations. They would call 911 in that case. Of
course, if there's in a crisis.
Baker acting in Florida, so that can take place. They obviously, I know about that if it happens, but I don't have to initiate any of that because it can be initiated through
the facility where they live in.
Correct.
Oh, that's good. So, if anybody is experiencing like a crisis, is it best for them to call 911 or like there's the suicide helplines?
I think either one, just getting an emergent person, because if you're calling the suicide line, they're well equipped
to send, I just don't know, can they track where they're calling from?
I don't know if it's anonymous or not. Again, my population, like I said, I don't. No,
you don't know, but I don't think it is. So, but I'm sure they would get somebody on the other line to maybe ping the phone or something.
They can.
So if any of our viewers are experiencing a medical emergency, please call 911, or if you know somebody, please share the information with them, because we don't want anybody to be in a situation where they don't think that they can get help. There's lots of help. There's lots of organizations. And I know there's even lots of like we were talking about telehealth online, so they can do it in their home. There's apps that you can do. You can get your therapy appointments in a discreet manner. You can text, you can chat. So there's ways for people to get help and like express their feelings without feeling like ashamed.
Yeah. Yeah, it's much more accessible in a good way. Right.
Yeah, in a good way. Because, the technology is good and it's bad in some ways. But
yeah.
And that's another thing. I think some of this, the upcame, especially in like the younger generation, is because of like all the social media, like bombarding them about like, it's supposed to be like this. And I'm like, no, it's not really like that.
Yeah. Remember the days when you didn't know what your friend did all summer until you saw him at school? You know what I mean? It's like,
that was...
those were
a lot more innocent.
They're in Greece. Okay, great. You didn't know that until you went back to school.
Until you saw when they came back, and then they had their pictures.
It was like a 5-minute conversation. I was in Greece this summer. Oh, you were? Okay. And then you just move on. But you had a great, you
had a great time. Or you went to camp, and then you could go on the phone and call like your parents on the phone. You didn't have like your cell phone with you.
You don't have to know what's going on with every single person at every
24. That's why sometimes when I get
summer than you?
overstimulated, I like leave my phone like downstairs and I go upstairs and work and do something where I'm not going to be like called or texted or tempted to like doom scroll on the socials.
Yeah, that's another
which
one.
is another.
And that's another one of those recognition things where you're like, do you even recognize that's what's happening?
Yeah. Or do you know, have you been doing that for 3 hours? Because I've caught myself. I've wasted so much time. I could have done so much stuff.
So many things. Have you noticed that you were in a good mood and then now you're not?
Right.
You know what I mean?
You're irritable.
Like, yeah. So I don't know. I think recognizing it is like probably a huge portion.
It's like self-recognition.
I don't know. I don't mean to like shame anybody or make anybody. I feel like most people don't recognize that that's what's happening. They think they're handling it fine. They're like, not a big deal. It's just, they don't realize that it's like,
they don't realize how they're portraying on like other people.
Seeping into all these other things.
Other parts of their lives.
Yes. Yeah.
But now we're going to talk about a little bit the fun stuff that you get to do, because she's a nurse practitioner on the day to day, but she also has a med spa. Luminous Skin Med Spa, which I've been a patient of hers for like years, and I always get it wrong. So I just say Luminous because it's easy, and it's on 434 in Longwood, which was close to where I grew up. So she does great services. I just did the microderm abrasion, which was the diamond glow, which I did that a couple weeks ago.
Your skin looks great.
Is amazing. Yeah, my skin feels really soft. It's like taking off dead layers and stuff. I went in the sun. I put tons of sunscreen on. She also does the PRP, Botox, fillers, semaglutide, trizipatide, NAD, B12, everything. So I've tried just about everything there, and it's all phenomenal.
Thank you.
Yeah. Yes.
It is fun.
It is fun.
Job.
That's the fun part.
Yeah.
So you got to fix your insides, and then you fix your outsides.
Yes.
With her, she can do everything. But thank you for your time.
Of course. Thank you.
Thanks for joining us. We'll have you back.
Thank you.
Thank you so much for listening and joining us on our podcast episode that's posted bi-weekly. Again, we would love if you would like and share and subscribe to our podcast. It means the world to us, and it helps our guests so much. Remember, if you would like to join us, you can do so at any time. We record in person or on Zoom anywhere in the world. Also, our podcast is produced by Sean Spazzato, and it's hosted by me, Miss Colleen Pacheco. Please like and share our Facebook pages, which is Colleen Pacheco and Secured Insurance Group. Our Instagram is Colleen Insurance Lady 22, and our cover art is edited by Norma Pacheco. We appreciate you so much, and thank you so much for taking the time to join us.